Jocelyn Sisto. I'm a physician assistant with Dr. George Corris at Midwest Plastic Surgery here in Illinois. We're very excited to offer Votiva. It's a wonderful treatment that can be customized to patients. The way we do it at our practice is that we evaluate our patients and customize the treatment based on their concerns. Some women have more stress incontinence, others have more urge incontinence, some have more symptoms of classic atrophic vaginitis or just general atrophy of the vaginal area. The beauty of Votiva is that it allows me to customize what I would like to change in the tissue for the patient's concerns. And I've been very impressed with how the system is able to really make a big difference in the tissue and also the patient's quality of life. Our patients are so excited when they come back after their first treatment and they tell me they can't wait for the next one because the changes that they see are greater than anything they've had in the past. Most of our patients have been connected with pelvic floor physical therapists and have tried a variety of things. We do like them to go for an evaluation first so we get some really good, nice baseline readings, and then we can kind of customize and tailor their progress as we see the changes in the tissue over time. Today we're going to be doing a Votiva treatment which consists of a combination of Fractura V and Forma V. Both treatments are indicated for improving the vaginal tone of the vaginal canal. They also are showing promising signs of helping pelvic floor relaxation syndrome, along with signs and symptoms of atrophic vaginitis or atrophy of the vaginal area. Women often complain of symptoms of stress or urge incontinence and also vaginal dryness and sometimes even pruritus or itching in the vaginal area. So it's a very exciting treatment that offers a combined approach to address multiple symptoms that many women suffer with, and there's not a lot of indications that can address all of these in a single treatment. We're going to start today with the Forma V. Before we do that, we're going to apply some topical numbing cream to our patient so she's completely comfortable throughout the entire procedure. Today we're going to be talking about the Votiva Forma V handpiece. Here we have the Votiva disposable handpiece connected to the reusable base. You can see the gradations marked out in centimeters along the shaft of the applicator. At the distal end, we have 3 electrodes. These 3 electrodes need to be maintained in contact with the vaginal canal, so pressure does need to be placed by the operator to ensure good contact. Before treatment begins, we actually need to measure the vaginal canal. Each patient's vaginal canal is slightly different in length. We don't want to treat too far so that this probe is hitting the cervix. So if we measure at 8 centimeters for the total length, we never want to treat beyond 8 centimeters in depth. So bringing Votiva into our practice has really been rewarding. One of the things we look at for new devices is, first of all, is it safe for patients? Second of all, is it easily reproducible? Third of all, does it deliver consistent results? InMode has surpassed all of these expectations with every other technology, so it only made sense that the Votiva system would fall in suit. Some of the safety features we really enjoy are the cutoff temperatures, the actual real-time monitoring of the tissue temperature during a treatment, the fact that the system will self-regulate, so when the tissue reaches your cutoff temperature, it will shut the energy off, so we can't overheat a patient's tissue. Then the temperature sensors pick up when the temperature drops, so then the RF can be applied again. What this does is it creates a steady state. If you've got your goal here, we want to be hovering around our cutoff temperature to really maximize the tissue contracture. So the Votiva Forma V allows us to really maximize our tissue contracture for patients. And what does that translate into? Because everybody talks about this. One of the biggest things we've seen is the internal contracture really picking up nicely. In fact, I can even feel it in the middle of a treatment. The tissues actually will contract around the applicator, and over time, it continues to improve and tighten. So this right there is huge for so many women. Now we add the Fractura V component to it, and it addresses so many of the other external issues with atrophic vaginitis, where patients are starting to see some atrophic changes in the skin and the tissues, and they have a lot of symptoms related with that. To be able to have something fill the gap from symptoms to surgery is huge. And vaginal devices right now are all the buzz, and a lot of them offer piecemeal, different things for the internal, different things for the external. I feel the Votiva system gives a comprehensive treatment approach that you can customize for each patient. Allowing us to do that really kind of fills this void. You know, either patients were undergoing surgery. In a plastic surgery practice, we offer patients labiaplasty to help improve the cosmetic appearance. now I have an alternative treatment if they did want to use something non-surgical. For the patients that need bigger surgeries, pelvic floor repairs, things like that, we're seeing really promising results showing improved muscle tone in the pelvic floor. So this is really exciting because patients can hopefully stave off or at least improve the results. If they still need a surgical procedure, we've now strengthened the pelvic floor significantly for them in a way that pelvic floor physical therapy was really the only alternative they've had. In our practice, as we are a plastic surgery practice, we work with a team approach. So we bring in physical therapists, we bring in gynecologists, and we kind of address each patient's needs individually that way. This has allowed us to really offer the best comprehensive package for all of our patients. Patient reporting to me have been wonderful. They're excited to see changes even after one treatment. They often come back and tell me they've had less urinary incontinence with just a single treatment. And it just builds over time the more treatments you do.